So I figured this was a good place to start, because I mean, you all know best really, but that mind-body connection is very, very important. It has a huge effect on your emotional and your physical health. And since we are talking about sexual function, obviously physical, but it is a huge emotional piece as well. And when deciding to get back into all of that after your injury or, down the road is a lot of emotional that you have to take into account as well. Thinking about those positive emotions such as joy and desire and excitement that may boost that pleasure and satisfaction with any of that sexual function, but then also those negative feelings as well. And I mean, that's for really anyone. Doesn't matter if you have a spinal cord injury or spinal cord disease or disorder, it's really anyone. Think about if you're stressed, prior to your diagnosis, you probably weren't going to want to have to engage in any of that previously. So thinking about some of those emotions that play a part, and thinking improving your mental state is very important to playing a part into this. And if you're in a good mental state, that's going to help with facilitating this as well. We'll talk about that a little bit more down as we keep going. Obviously your image of your body changes after having any sort of accident or diagnosis, and learning to re-love your body is important. If you focus on improving your self-image, that's going to ultimately benefit you and your well-being and ultimately your sexual health. Okay, let's come on. Okay, so sexual function and sexuality. So I think it's important to note that sexual function is more than just the physical ability of having sex. It is a feeling of being a sexual being and sharing your sexuality with another person if you choose to. It doesn't matter what your injury was or how serious your injury was. It can't take away your ability to have a relationship, experience love, experience attraction between two people. And I think that's a really big factor to remember with all of this. And remembering that you're more likely to feel desirable and want to fully express your sexuality if you understand your body and feel more comfortable with yourself and your personal identity, which is, like I said previously, why that mind-body connection is so important. Okay, so now into a little bit more interesting. So just talking about arousal in general. So there's two main types of arousal. So psychogenic and reflexogenic. With the definition for psychogenic, this results from sexual thoughts, hearing, or seeing something sexually stimulating, versus reflexogenic results from direct physical contact. When an individual has a complete spinal cord injury, which is usually above T10, that psychogenic arousal aspect is affected. On the other hand, the reflexogenic arousal is often preserved. And so with individuals who have a loss of the psychogenic arousal, it's important to focus on the five senses to be able to assist with achieving a successful state of arousal and sexual functioning. This state of arousal may be a little bit different than you may have known previously, but it's still very possible to get to a point that it's still successful with trying to use some more of those different aspects with your five senses. So like thinking about maybe there's, like a certain smell that may make you feel more aroused, like think about, I don't know, let's say if you had a partner or spouse previously, or even now, that like some cologne that they wear or perfume, something that may trigger some sort of arousal, kind of trying to break it down into those smaller aspects, because that honing into those different senses can really still achieve a lot of that for the brain. And I think people kind of forget that there's a lot of different aspects that play a part into it. It's not just that physical aspect. And just being mindful that, you can feel sexually aroused without responding to arousal in the genital area. You may not be able to achieve that vaginal lubrication, but you can still be aroused. Any questions so far? We're doing okay. Yeah. Okay.
So what happens if you don't get aroused and you can't feel it?
Let me make my screen bigger. Sorry, who said that?
What happened if you don't get aroused? What happened if your whatever they do or whatever smells and stuff like that don't turn you on and stuff like that? What happens? But you love that person and you can't.
So really, you're the only person who can determine if you're aroused or not. You may be showing it in a different way than maybe they're anticipating, or that they determine that you should be aroused, but you're the only person who can determine if you are aroused or not. And, sometimes it's not just like the arousal part is if it's important to you, it's not necessarily like needed to love someone, that's a different part of a relationship, and that's an important part as well. Does that make sense?
Can I say something very quickly?
Yeah, of course.
Unique. So sometimes, especially like early on when you're trying to get like reacclimated into like sexuality and everything, we're in our heads overly focused on that, what we can't do, what we can't feel. How am I going to feel this? How's it going to happen? It's not happening, right? And so personally, when I learned to take time and almost I go into a meditative state and listen for everything, all of the other senses that get heightened. And now like I'm turned on by audio things, like just hearing things, it causes a serious physical reaction, a certain kind of touch where I can feel, and the other parts that are heightened compensates. Like somebody could stay up here for hours and I'm good. So it's about kind of trying not to focus on what you can't feel or how you're going to feel that, and letting what is going to arouse you now come to you. Don't put pressure on yourself or on your partner. Let it come. Does that make sense?
Yes, I love that. Yeah, that's really, obviously you all know best. It's important to try to let go of what things were maybe like previously and try to hone in on what things are like right now, to try to get more of those senses going, like Natalia was saying. And you'd be really surprised on how much more heightened they are as well, because of some of the decrease with the other areas. And that's just, we're going to play into those parts, which we're kind of going to go into with the next slide. Does that make sense, Unique? It's okay. I don't want to call on anyone. Okay. All right.
Thank you.
Yes, of course. All right. So with some of these physical difficulties and some sexual functioning, we are 100% gonna conquer them. That's our ultimate goal. And like a lot of the things that Natalia was just saying, with individuals who have paralysis resulting in loss of sensation or decreased function in sexual organs, the sensation above the level of injury are unaffected, which provides a great opportunity to explore some of those erogenous zones that have been unrecognized or underappreciated. So, some of those areas that tend to be a little bit more sensitive, think like torso, neck, head, especially those areas that are ticklish under the arm, inside the elbow, the ears, the area of your chest where the sensation changes is often found to be sensitive area that can provide some of that good pleasure. And like Natalia said, honing into those areas, really trying to focus on what you're feeling, what you're smelling, what you're hearing in that moment to try to boost some of that, pleasure and arousal. And, some have said that fantasy and even sharing fantasies with their partners have enhanced their sexual experience, as well as, making sure that your sexual relationship is unique to the two of you, and so that it's more satisfying for both of you in the relationship. We'll get into it a little bit more, but obviously that communication piece is very important through all of this, so that you're benefiting in the best way, and so that they are too. It's a big communication piece as well. Okay, so for other aspects that may interfere with sexual function, stress, fatigue, any depression, pain, fear, some prescribed medications or recreational drugs can play a part as well. Any negative past sexual experiences. I think this one's a good one to target and to focus on, because it might be, obviously, if you're newer to your injury and you haven't really dabbled in this at all, or if you just haven't dabbled in this at all and you're a little bit down the road in your injury, the first experience, or maybe multiple, may not be the best experience of, participating with yourself or with someone else with this. And it's important to not let it get your mood down about it all. I've talked to many of my patients about this, and I'm sure you all have some stories as well. And, bowel accidents, bladder accidents, it's gonna happen. And I think it's important to talk about it, but not letting it make you not want to participate in it at all, trying to overcome some of those, because that's gonna, we gotta just move past some of the rough parts of it too. Another aspect you could say is like power and control in relationships. You may feel after your injury or diagnosis that you have less control than you previously did. Loss of interest in a partner. It might be that the relationship has changed a little bit since you've had the injury or diagnosis, or your self-image has changed. Hormonal influences can definitely play a part as well. How we doing? Everyone good? Okay. Oh, and then with any of these, it is important to try to talk, with your doctor if you feel comfortable. I know it's a tough topic to bring up sometimes, and sometimes doctors can be not super great at making you feel comfortable to talk about this. So, if you are going to therapy at the time, or you have someone out there that you would feel comfortable going to, there's many resources online as well for trying to address some of the blocks that you may feel with any like sexual desire. Okay, so dating and relationships following. Who is currently dating right now or in a relationship? I don't know if we can do that raise hand thing that Natalia was talking about. No? Yes? Okay, we got a good amount. Okay. Good. So, with dating, so after experiencing a spinal cord injury, as you know, or diagnosis, as you know more better than I do, it's common to feel fearful, which is normal. And that's okay to feel fearful. I think the most important part is to try to get past that fear, which is definitely a process. As I've talked to with many of my patients, when they come straight from inpatient and down the road when they're maybe more ready to talk about it. But unfortunately, many people are not comfortable talking about their fears with, say, if you are in a relationship or you're married, with your spouse, with your partner, with your significant other, many won't talk about their fears with them. And I think it's important to know that your spouse or your partner or your significant other also has fears themselves. So it will be good to talk about it together so you guys can address those fears together and form your new relationship that might not be exactly how it was before, or it might be actually be better with all the new communication. And trying to discuss these concerns with your partner, your significant other, sooner rather than later is always good, and it will help you relieve some of that anxiety as well. In regards to dating, has anyone been online dating at all or using any of the apps? Anything like that? Yeah. How's our success rate with it? Not great. I'm seeing thumbs down from Lily over there. So Natalia, okay. So I will tell you, I'm a little bit different boat, but I did meet my fiance on a dating app. So there is some hope out there. Is some weirdos on there too, though. But the dating apps are nice because you can kind of pick and choose. If people honestly tell about themselves, people could totally be lying about stuff. So you gotta be careful there, but it's a good option for trying to meet people. And, if you're a little bit worried about getting out there in person, you can kind of chat with them online first or on the apps first before, making an appearance and meeting them in person. There are also some websites and online forums where they're specifically for individuals with disabilities. If you're looking for, something like that to discuss a little bit more. And, even if you don't find your match on, any of the dating apps or online, it still is a good way you could meet people and friends, and you might just develop good relationships overall. But the dating part is definitely something you have to be ready to do. And it may take some time to get there, but I think once you rip the Band-Aid off and you get going, then you'll start feeling a little bit more comfortable with, chatting with people, with explaining your diagnosis, your injury, anything, that may come up that may be a first for you.
Alyssa?
Yes.
Do you have actual sites, or do you have resources for the online dating sites specifically?
Yeah, I can send them after, actually. If I can send them to you and you can distribute.
Perfect.
Yeah, okay, perfect. Anyone have any, things that they've experienced with dating or relationships that have been tough to manage, to deal with, that you want to share? You don't have to share. I know this is a little bit tricky.
Anybody? I will share this quickly. So first, actually two things. So first, it took me a long time after being injured to even want to be sexual, to re-identify, as a woman and all these things. So when I started getting on the apps, I actually found a guy that was a nurse. I said, this is perfect. And I was honest and explained the whole situation. Like, I want to relearn my body sexually, and are you down? And he was, and it was great, you know, and I learned about my body. It was fantastic. And then another time that online, I actually wanted to find like a relationship at this point, found somebody. The first time that we went to have sex, I shit the bed, literally, and was mortified and was like trying to like kick him out and everything. He refused to leave. And he just like went and grabbed my wipes and just cleaned me up and just changed everything and kissed me and just cuddled with me. And we stayed together for months after that. So after that, it was off to the races. Just saying, get out there.
Yeah, I've actually one of my patients has a similar story like that, and I think that's amazing that there's great humans out there like that. I think we like to just think the worst of people, and I mean sometimes we can be right, but we can't always just assume that people are just going to react super poorly, and it's part of the process. If you can try to laugh it off as much as you can, that's, humor is going to be your best friend, because none of these situations are going to be super fun. And I mean, I'm like one of the most awkward people yet. So, I mean, I get it. Okay. Yeah. I'll share those websites, after, so you guys have a list of some options too. Okay. All right, so I know we don't love discussion here yet. I'm gonna try to pull it out of you. So with anyone who has returned to intimacy and sexual functioning following, have there been barriers that you've experienced, and have we overcome them well, or had trouble?
Something I was thinking about,
Mhm.
just the idea of, I think after my spinal cord injury happened when I was 15, so I actually did not have a sexual life before then. But I noticed for a long time, I was sort of using sex as a way to feel good about my body. Like it wasn't like I wanted it, but I wanted to be wanted.
Mhm.
And I guess I kind of moved past that, but I still feel it. I don't know. I'm just wondering whether other people have similar experiences where it's very hard to move past that because you can't really separate the two things, like whether you really want it or you just want the validation.
Hello?
Yeah, Unique, go ahead.
Oh, sorry.
Oh, okay. I guess what I first think of, Naomi, is, do you fantasize sexually, either about what or a specific person or in general? Do you fantasize sexually?
I mean, yes, that's actually a great point. So I guess it's not that I don't think I ever want sex. It's just a lot of times I can, like, in the moment. And I guess it doesn't really matter in the moment why I want it. It's just something that I think there was a time in my life where I behaved probably pretty not safely because I was wanting that validation so badly. And I don't do that anymore, so it's probably not an issue, but I'm just wondering if that's like a common experience.
Like seeking validation through sex, you mean?
Yes.
I get that. I feel like seeking validation through sex is kind of parallel to wanting to be more in tune with your own sexuality, That's how I see it, I think. Because I know exactly what you're talking about. And there are times that I've like been in situations and it's like, I want to be looked at as sexy, I want that validation from somebody else, but I had to work on trying to give myself the validation. I think that's how I see it.
Alyssa, are you raising your hand?
I don't know how to do it on my thing.
Oh, yeah.
I just wanted to say that like, Naomi, what you're feeling I don't think that is specific to a person with a disability. I think there are many able-bodied people out there who do the same thing, you know, use sex for validation.
Yeah, I think that's totally true. And I think it, you know, with how your injury was when you were so young, you know, you don't really know who you're trying to figure out who you are at that age too. Like that's a tough age. And I think that's just probably something that you turn to, which makes sense completely, because I mean, there's many, yeah, like Alyssa said, able-bodied people that do the exact same thing around, you know, those teenage years too, because they're just kind of lost in what, and who they are really. So you're, you know, when with a spinal cord injury, it just adds another dimension of trying to figure out who you are.
Day, raise your hand.
Hello.
Hi.
Yeah, I've came on here a few times. I'm kind of shy, so I haven't really said anything. But I'm not sure of my injury. I'm paralyzed from the waist down since 2019. And I haven't really wanted to be with anybody. I've thought about like certain things, but it's like I just haven't wanted to, because like some of y'all discussed, it's just like not feeling, how you say, in tune with my body, or feeling sexy, or however you want to put it. But I wanted to, and a lot of these dating apps for disabled people is just a lot of weirdos like Alyssa, Centi, I can't pronounce your name. How the other Alyssa said it, the presenter. It's a lot of weirdos on those apps, and it's like once you start talking to somebody, going normal, it's like it's totally opposite. It's like it's just hard out there. So I understand where y'all coming from. It's just like I don't know. That's all I want to say.
Yeah, can I also say, I completely understand. Nice to see you.
And you are sexy. You're very sexy.
Oh, thank you.
You're very welcome.
Well, speaking of that, I like I said, it took me a long time after being injured to get there, because I didn't feel sexy. I didn't feel like anyone would want me sexually and everything. And what I can say is that after just doing it, just saying, whatever, I just need to do this. After doing it, it helped to make me feel sexy. You know what I mean? Like,
yeah,
just engaging in it, it helped me remember, oh, I am a sexual being, and you can own that. And, you know, sometimes you have to fake it till you make it, you know?
I hear you.
Just so you know, Rihanna once said that she never felt sexy and she had to fake it till she made it. So, hey, follow that model.
I'm gonna go back to the other way because a lot of noise and stuff in my background, but I'm hearing you.
Okay, nice to see you.
Okay, you too.
Anyone else have some further input on the first question? Alyssa, are you raising your hand?
Yeah, I don't know if it really like is related to this. I just wanted to say that I've been injured for 31 years. And in the beginning, I really had no sensation at all. And I experimented with people, you know, just to see what I could do and what I couldn't do. And over the 30 years, I have gained a lot of sensation. I don't know that everybody is going to experience that, but I think many people will, especially if you're mentally focused.
Yes. Yes, I agree. Same thing for me. The sensation increased with time.
Yeah, there is a lot of research and just likelihood out there with returning sensation in that, we like to call it the perineal area. Even if like some other areas aren't returning, that's been pretty common that we've seen. So
is there any truth behind my personal thought that the more usage you give it, it'll get more sensation? Is that a thing?
I don't know too much about that, but I would like to think, yeah, I would like to say yes. I mean, with sensation in general, like the more, depending on injury wise, really, and everyone's so different, but the more you try to expose an area to sensory aspects, the better, if that makes sense. So with any area that is maybe, you know, a little bit duller than another area, you know, trying to try different like fabrics and textures and things like that is good for that just sensory input in general to try to boost it.
Oh my God, I'm sorry. Sorry. Okay.
Okay, my other question I was thinking we could discuss is, you know, what obstacle scenarios have you guys overcome with returning to dating or returning to a relationship? I know Day was just saying it with the apps, you know, there can be some like weirdos on there sometimes, but like anyone who's maybe like was in a relationship when they had their injury, was there things that you had to overcome, or, you know, married wise, like anything like that that you guys have been dealing with or dealt with?
Alyssa.
Yeah.
Oh, I was talking to the other.
Oh,
Alyssa.
sorry.
Thought-
Getting real confusing.
Sorry, Alyssa with a Y. I'll do Alyssa with a Y and Alyssa. With
I don't know, you know, I don't know. I just jump in there. I'm actually kind of a little, I've been together with my partner for 24 years now. So, and when we first met and got together, we had sex that night. He was like my only one night stand. I was almost 30 years old. I just bought my first sex toy and there he was. But
Nice.
and he never left. And but we got over the sex thing like immediately, so it wasn't a thing, you know, whereas people had met before that, or, you know, had explorations or relationships with before that. I mean, something as simple, I didn't have sex with anybody before that, but I mean, after I broke my neck and after my boyfriend left, so for like 7 or 8 years. But you know, things like I would go to dinner with somebody and I was, you know, on a quad, I didn't like to have to hold my silverware and eat in public. So I wouldn't. And if I didn't do that the first time we were together, I would never eat in front of that person, you know, and I would drink my margaritas and I would get shit-faced, you know. But I think the sooner you get over having, you know, the sooner you deal with these things, the easier they are to deal with. Something that you had in another slide. Yeah, that's all that was my only obstacle, was like just getting past myself, you know?
Yeah, and I think that obviously because, you know, it is yourself, people are more focused on themselves and think that everyone else is as focused on them as you are on yourself, but people really don't care, to be honest, you know, like people, as much as like we are hard on ourselves, like, you know, other people don't care as much as we probably think that they would.
Can I add something just to add to what Alyssa with an I was saying? Because I had a sort of similar thing. I had all the stuff that I was super embarrassed about when I would be in relationships. Like I wear AFOs, which for some reason I didn't want anyone to see, even though, you know, everyone knew I had a disability. So it was kind of silly. But my catheters were one of the big ones. It was like this, nobody can know I have catheters. And my first like real long-term relationship, I like tried really hard to hide them for like years. We were together for years. We were living together. And finally one day I ran out and I was like, I have a crisis. And I told him, I was like, Ken, you don't know this about me, but I use catheters and I'm all out and I don't know what to do. And he said, of course I know, like they were in the bathroom, like, what are you talking about? And it was just such a relief. And I felt so silly for having tried to hide it for like so many years. And it was a big nothing. So just add that.
Yeah.
I did the
Thank you for
same
sharing.
thing, Naomi. I did the same exact thing.
Okay, I'm glad I'm not the only one.
No,
As if
but
you never
I'm
told
worse
her.
because I have to self-cath, and so I like every 4 hours I'd like kick him out of the room, be like, I need you to stay in the kitchen for like 30 minutes. This went on forever. And then one night he was just too tired. He's like, I know what you're doing. Just I'll stay here, turn on my side. Just do what you gotta do. I'm like, okay. So that broke the ice.
Well, even with me with my diazepam to help incontinence, I told Marco from the beginning, oh, could you give me my pissy pills? And he's like, what? Oh yeah, my pissy pills. Those are my pissy pills. They help me hold my piss. And he's like, okay, whatever. But that's, I mean, if you can't laugh about it, you're either gonna laugh or cry, so why not make a joke?
Amen. Amen.
Exactly. Humor is our friend.
I also just want to add, unless someone else has something to say, I can't see if there's any more raised hands. Nope. Okay. I wanted to add that something to overcome in terms of relationships. So I know this happens to a lot of people, but when I was injured at the time, I was in a relationship, because it was off and on, but I was in a relationship, and then he couldn't handle it and disappeared. And I know that happens to a lot of people. And so the obstacle with that is not making that a me thing. We do it a lot. I made it a me thing. Like, I'm not good enough. Nobody's going to want me like this. Like, I made it a me thing when it was a him thing. It was a they thing. And so I just want to mention that, because I know it happens a lot, and we have to remember not to internalize other people's shit. Like, we're awesome, we're fantastic, we're sexy, and we need to own it.
Yes, 100%. All right, any other input before we get to more fun stuff?
I just wanted to.
I wanted to say that, stimulation, what I actually get a high on the guy, hearing him being pleasured, when he moans a little bit, that turns me on, because that means I have the situation under control.
Yeah, exactly.
It's a control thing for me.
Yeah.
So I just wanted to add that in.
Thanks, Sylvie.
No, and that's a good part to focus on. If that like increases your pleasure and your arousal, I mean, that's kind of like, a pretty easy thing that we can control,
Yeah. Jessica, were you gonna say something, or did the sound just come
Yeah,
out?
no, I was just gonna say, I think, my perspective is a little bit different, and most of the girls here have heard this already. But I am a person with a disability, but my partner has a spinal cord injury, a C5, I believe. Yeah, he's a quad. Anyway, so like I remember when he and I started talking, and just like his whole intro into like bowel programs and accidents happen, and I just remember like zoning out and thinking about something completely different when he was talking. And then I just came back and I was like, yeah, I get it. Are we gonna get it in, or are we gonna keep talking about it? But I'm saying that to say, yes, I am a person with a disability, so it does make it easier, and I have a more understanding of disability. But it's so true, that people really just don't pay attention to that stuff at all, really. Especially when they give a shit, you know what I mean? Like, and even when they don't give a shit, they just need a hole and a place to put it,
Seriously. She's so right. I remember early on, this is before I had sex and I was still like really insecure about it. I was hanging with a bunch of friends, and there was another girl that uses a wheelchair, and I guess she was passing by. A guy was attracted to her, and he said, I'm sorry. He said, man, if I ever got the chance with her, I'd just rip them huggies off and go to town. And when he said that, I was like, oh my God, he doesn't even care like about, so it made me feel like, okay, somebody else might want to rip my huggies off. People don't care. People don't care.
Don't make me choke on my water.
It's true. Oh my my God. And there's been times when I had the indwelling catheter, guys will just be like, we could just put that to the side, right? Like, they don't care. They don't care.
Yeah,
They
it's
don't
true.
care.
It's true.
It's true. And he had a whole PowerPoint presentation. I'm like, dude, relax. Let's just get it in.
Oh my God.
Yeah, hey, at least he was prepared. Give him credit.
Okay. All right.
Okay. All right, let me skip this. Come on. All right, I really like this picture. Oh no, go back. I really like this picture and I like wasn't sure if this was gonna get approved by my work, but they didn't say anything, so I think we're okay. But so adaptive positioning. With, you know, any sort of, I love Natalia's face right now. Like,
Oh, sorry. I'm sorry.
so, you know, mobility and positioning issues, you know, may present some challenges during any, you know, sexual activity. And there's a lot of different positioning things out there that you could purchase if needed to assist with some of the positioning, we could say. So, you know, some easy ones, obviously, like our pillows, you know, cushions, I guess you could take from the couch if you wanted to. But then there's also like actual positioning items out there, which we'll get into next. But yeah, I just like really love the picture. And I was like, if anyone tries to flag this, I'm gonna be really pissed. Okay, so positioning wise, come on. So has anyone seen The Intimate Rider at all? Yeah. Yeah, I think this one's a great one and that's out there. You know, this one was initially developed by an individual with a C6, C7 level injury. Yep. And mainly the focus is to help facilitate any sexual activities, emphasizing any thrusting and sexual movement. That other piece there is the leg aspect, and it's meant to just assist with additional stability for transferring. These are a little bit expensive, I will say. You may get different prices if you look online, but they're ranging about like mid 300s, which is pretty expensive. But you know, if you're, I guess, investing and you know you're gonna get things going quite a bit, then I guess it's worth it. Alyssa, you have a question?
Yeah, so I mean, I've seen this before, not in person, but I always thought it was for the guy. Like how
So yeah, you can use it for, it depends on what you're doing. Depends on what your choice is there. But yeah, so options out there.
Doggy style.
What's that?
That also tastes doggy style.
Yeah, so yeah, it depends kind of what you're doing or what your preference is. You know, I don't like to assume anything, so put everything out there. But for other positioning aspects, there's the,
Tiffany had a question.
oh,
Tiffany.
sorry. Go ahead, Tiffany.
It's not so much a question as it is, I'm glad that you said who designed it, because a lot of people, when I've been in like disability, sexuality talks, they bring this up all the time. And it's great if you've got the capability to use it, but it's not great if you don't have the capability to use it. So the fact that you actually like give a qualification on who designed it, and it works, I think, best for somebody who's got balance and hand movement, at least somewhat. Because but there's a website that crap, something sheets, and they've got like some of the
Sports
best
sheets.
stuff.
Sports
Thank
sheets.
you.
Yes.
Thank you.
I got a
Yes,
bag full of their shit.
there you go. Yeah, they have the whole neck, arm, wrist thing that holds everything open, that I think is just probably the most genius idea that they didn't even realize would help people with spinal cord injury.
Yeah.
So, yeah.
I was gonna put something like that in here, but like my boss had to look through this and I was like, this might be a little uncomfortable.
Yeah, but still, I think that if this is about disability and sexuality, they should be allowed.
Yeah, they're, you know, little, can be a little.
That's my opinion. That's my opinion.
But yeah, I agree balance wise that, you know, if needed, and you want to try something like this and balance isn't great. So another good option you could do is if you have like wedges or even pillows that you can put on the sides to help stabilize the arms a little bit more. That could help a little bit more balance wise, because I really wish that it did have a little bit better stability on the side. I don't love that too much. But options wise, it's a pretty good option, you know, that is out there. So the Liberator shapes, there also is one that has like an attachment that you could put a, you know, dildo on if you wanted to. I just didn't put that one on here, but just so you know that it's out there. So these are mainly to try to help position for, you know, optimal, you know, with a partner, or if you feel like you're going more like the self-pleasure route, that's totally fine too. But it might just help with like positioning legs, positioning your trunk, so you can kind of like see what's going on a little bit more, rather than just laying like completely flat. And let's see, these go for a little bit pricier side too, but you probably may be able to find cheaper options too if you kind of search, but these are about in more like the 200 round. And these can also help like alleviate like spasms, reduce some of that lower back pain, and makes it a little bit easier to get to like, you know, those genital areas. Any questions on these at all? Yeah, Natalia.
So the issue I have with these is like, so for instance, take the shape on the right, all the way to the right. I do not use a Hoyer lift to get to bed. My aides usually just pivot me on to sit on the bed.
Yeah.
Let's say that I'm not dealing with an aide, I'm dealing with a person. Let's say I'm dealing with another person that's in the chair that might be able to transfer themselves. Like, so getting on that, I can't find, I've tried, I can't find ways to get on it. Okay,
So if you were to so your aide transfers you onto the bed typically, is that what you said?
Yeah, with
so
a
if your aide was to help you transfer onto the bed, and then if you're like sitting at like the edge of the bed, and then you guys pop your bottom up onto the lip, do you think then you'd be able, you know what I mean? And then so like she would have to like scoot it underneath your bottom as you guys pop up a little. Honestly, I feel like I could totally do that with you if I was transferring, at least. So it wouldn't be like a roll ordeal, like you wouldn't like roll onto that. You'd have to pop, you have to get your booty up a little bit, and then she'd have to shimmy it under, really.
I mean, I can't lift my butt much. That's
well, she could, or she or he could help you lift your booty. Yeah. I can literally vision it in my head right now how I would do it.
If you're saying you could do it, like we should like make a video with like different materials showing how we can use it.
That would be pretty cool, actually. I'd like that.
Yeah.
Natalia, you need stronger partners.
Hey!
my husband can like put me anywhere. Honestly, he's getting older, but he could get me on that.
Well, partly the issue is I'm an equal opportunity lover, and sometimes my partner might not be completely able-bodied. There's the issue.
Well, there's that maybe you wouldn't be using that.
Right.
Can I say I am all for those videos, because I don't know if anybody knows we're recording anyway. I'll mention the name later. But there's a doctor out there who made videos, but the woman was a para, and she was able to kind of throw herself all over the place, which is really helpful for people who are paraplegic. But for quadriplegic, he didn't have any videos. Yep. So I think that would be, I would think that would be an amazing video series that would be very useful.
We should do it.
So I'm all for it.
We should do it. I can get a grant to buy all the stuff too and just go to town.
No, seriously,
yeah.
I really don't think if I'm thinking about it correctly, I think it's totally possible because honestly, they're not, the shape of them, we use wedges like that in therapy all the time. And I scoop people up all the time and get their booty like over it pretty frequently just for like better like stability. I feel
Yeah,
like
the
it wouldn't be that
wedge,
hard.
I think the wedge is doable. It's just the other ones because of that's
Yeah, we
where,
just gotta like get a little bit more pop.
okay, okay.
Yeah. Okay, all right, so more fun stuff. All right, so I guess the technical term would be adaptive equipment. I mean, it's really just like sexual devices, but we can call it adaptive equipment if we want to be, therapeutic, I guess we can say. So yeah, really anything you find online isn't necessarily made for just individuals with disabilities, anyone can really use it, and we can just make a lot of the sexual devices out there to just benefit individuals with disabilities. It's pretty great that that's like the option right now. So we'll like work our way up to some of the other things, but going back to some of the things that we said with like the sensation, with the torso, with, the neck, the ears, like things like that, with trying to increase some of those aspects that might be a little bit like hypersensitive to achieve any like arousal or anything like that. The wall massager is one of the options that you have different heads that you can put onto it. I don't know if I would really recommend this like in the genital area, just because it doesn't look super soft. But for like other body parts where you can feel more sensation wise, just for skin purposes, this can be used with massage oils to try to, maybe get us in the state of, feeling more of that pleasure, arousal to start, and then maybe like work our way to maybe some of the other things. But these, you can really find these like on Amazon, maybe $50, probably could find other options that are a little bit cheaper. And yeah, so like trying to focus on some of those underappreciated erogenous zones that we had talked about. And this one's more of like a PG that we have here, maybe PG-13. But this one's pretty normal. Could just be like a body massager if you wanted to. And let's see. Yeah, precautions wise, yeah, skin is always important. We know skin's important, so just always monitor skin if you're using it in an area that you don't have full sensation, because we really don't want any of those skin issues, wounds. We don't need that. Next one's a little bit more fun. The magic wand. There's also many other different types of vibrators out there. This one just has like some different options for, speed and all that. But yes, again, could be totally used on the body if you want to go that route, or you could do more genital stimulation too. Keep in mind, it's not waterproof, so please don't use it in like the shower or the tub. And definitely monitor for redness, irritation, and this can be used for self-pleasure for yourself. I mean, for your partner, depending on, what route you're going down. And these range from, it seemed like there was different options for, looked like there was like a pro one that maybe they've come in with like different versions, but there's like it's like 70 to 120, which is kind of pricey, but you can probably find other options for vibrators out there that are a lot cheaper too. Yes, Alyssa.
I don't know if you're going further with this particular product.
No, go ahead.
I'm very familiar with this product. It's one of my favorites. But
Yeah.
they do have attachments for the head, like different attachments.
Okay,
Like
nice.
a G-spot attachment and different dildos and stuff like that. Just so you know, but like they are, like the vibration is really intensive. So if I'm using it myself, like it's too much for my hand,
Mhm.
And And it does get hot after a while because it does take me a long time.
Yeah,
But
something to
that's-
definitely be mindful of. You know, if you're prone to dysreflexia, or like maybe overstimulation could cause any like bowel bladder issues, just things or spasms, just good to be mindful of all those things too. Any other questions about this one? Feeling good? All right, so more fun. So, finger vibrators. So these are great because you don't need active grasp or wrist extension. And you can utilize it for self-pleasure or partner pleasure. You know, if you're, say, trying to, say you have a male counterpart, you know, you're trying to stimulate them a little bit more rather than just with your mouth. I mean, you could just add this into addition if you wanted to. Options there if you're having, if we can't grasp or tenodesis isn't going great with that. And it's pretty easy too with the fair attachment. Also different versions out there. There's, I mean, if you just Google, you would find many different options. Another thing, not waterproof, so don't use it in the shower or the bath. And I like this one just because it's a great option for anyone who has trouble with their hands or wrists. And these range from like 20 to 70. That's what I was mainly seeing out there. Questions on this one? Feeling good? Okay. All right, even more fun. So again, so these are mouth vibrators, all different types out there. You don't, again, need hand or wrist to use these. So these are a great option too. Depending on what you're trying to get into, these are more obviously for like pleasure for your partner. But another option there, and like Selvi was kind of saying, if you're more aroused, like when you're pleasing your partner, this might be a good option too. And kind of just, you know, if more so trying to spice things up too, like any of these are good for that. If you're kind of just getting a little bit in the same routine of things per se. These range from like 30 to 70. Again, different options out there. There was a warning to not like use these against your like teeth. It's apparently not great for your gums, so just be mindful of that. Alyssa, yes.
I'm sorry, I don't understand these. Like, how do they work? What do you do?
So it depends who your partner is, really. Depends if you have a female partner, you could totally use it to increase some of those aspects with your male partner. Say, if you're, you know, gonna be going down more of like the oral route to try to like increase any arousal there. Does that make sense?
I think she wants to know specifically how these work.
Oh,
I
right,
think-
so like the one in the middle looks, it appears as though that fits over your teeth.
Yeah, it looks like a retainer, right?
Yeah.
So like if you're, say, you know, giving somebody oral, wouldn't that really kind of like interfere with the whole deal?
Yeah, that one wouldn't really work for that, but maybe the other one would. But like, say, you know, if you're giving someone oral and they're a female, think about it in that respect. Yeah,
Well,
I know not everyone has male partners, so I didn't want to, you know, put everyone in that category, you know?
Well, right, but so even with this one, like the one in the middle,
Yeah,
you know, what do you do with your tongue is not involved at all? How
no,
would-
your tongue's not involved at all because you don't need it to be.
Or just the thought, if you have it in on the bottom row, right? And you're performing cunnilingus here, that other part is hitting your anus.
True,
Can be.
that is true, there you go.
One thing.
How
So
would the one on the left work at all? Like, do you pop that in your mouth and?
yeah, that's what it seems like.
Yeah, I know
Wow.
there's some crazy stuff out there. Seriously,
what-
you should see my Google search history.
Ha!
The one on the right I just don't, I'm very familiar with sex toys and like, I don't know.
You like would bite down on that, on the top one, I believe.
Yeah, I don't understand this one because I feel like you have to have your hand. If you use your, I've been trying to figure that one out with the mouth.
Oh, the one in the middle?
The right.
Oh, the right?
Yeah.
I think you would just bite down. My understanding of that one is you bite down on the smaller part
Uh-huh.
and then you're just holding it like in your mouth. Does that make sense? Like with your teeth.
Oh, well, you're not supposed to use your teeth.
Yeah, I don't get that part either, but I don't know how, I don't think it could just lay in your mouth though, unless that part doesn't vibrate and just the outside, the outer part vibrates, you know?
Mm,
You know, someone's gonna have to buy them and test them out.
okay. Okay.
Any questions on any of these so far? Feeling good, okay.
I did want to make sure to go back to what Alyssa with an I was saying. I have the same issue with using vibrators that are strong. It bothers my hands before I ever climax. And some of them do get very hot. And since we have sensation issues, we need to be very mindful of that. In fact, I bought like a clit sucker on, damn it, Etsy. I should have known because it was on Etsy. I should have known. And I received it. It was from China. I received it. And my friend goes to put the batteries in and she's like, this is getting really hot, just like instantly. And she was like, no, I don't think you should use this. I think it's dangerous. And then when I looked up the reviews, people had burned themselves.
Yeah.
So we need to be very conscious of that. But what I did start doing, Alyssa, is I started looking for toys that I didn't have to hold. So like there's one that like it'll just do the thrusting motion. So I literally could just set it and forget it kind of deal. You know what I mean? And my hand won't get tired. And I found another one, the same kind of deal. It's like a thrusting, but then it goes around like a carnival in there. Just saying, there's options.
No, yeah, there's definitely a lot of options that you can just like set up and you don't have to hold.
Yeah.
Like I was saying, like with those liberator shapes, there is one that you can like insert. I mean, you could insert a vibrator if you wanted to, so you could just kind of hover over it or lay over it, whatever you're trying to do, so you don't have to hold it. But yeah, definitely being mindful of skin, because that's definitely a huge thing. We don't want any burns either. With that, we have lubrication options next. There are about 3 main different ones, and it's good to know about the different ones just because of like what they'll work well with. So there's water-based, silicone, and oil-based. Water-based, I just put some options out there. Obviously, like you can use whatever you prefer, but the KY is a water-based lubricant. These are safe with condoms and they're also safe with sex toys. The downfall of these are they dry out during use. So you typically have to add some water or more lubricant as needed. That's the only downfall of that one. Silicone based, that's the Durex that's there. This one doesn't dry up, it lasts longer than the water-based, but these cannot be used with silicone sex toys. So make sure you take a peek on what your sex toy is made of, because it will degrade it, unfortunately. Silicone on silicone, I guess that makes some sort of sense. And then there's oil-based, which is the Yes that's over there on the right. And these deteriorate latex. So if you're using latex condoms or latex gloves for some part of something, that's not gonna work well with the oil-based. Any questions on any of the lubricants? No. Okay. All right. So I have a whole section for considerations and precautions because that's very important with this as well. Definitely with any sexual encounter you're going to get into, sexual functioning, the time of the day and activities planned around it does become important. Thinking about bowel program, cathing, anything like that. Any sort of medications that may interfere with sexual activity, you know, such as like maybe pain medications or spasms medications may affect that. You know, trying to plan times that you have enough time to engage in any of these activities so you're not rushed and so you can experiment and, you know, do your thing. With safety wise, like we said many times, skin integrity, definitely be aware with any skin friction, prolonged positions, any current skin irritation, breakdown, pressure sores, in order to prevent further damage. That's something to monitor, you know, pretty frequently when completing any of this. Any of that altered sensation, you know, caution is recommended with the insertion of any sexual aids into areas that have diminished feeling. Definitely any areas that, or any sexual aids that increase in temperature. You know, as Natalia was saying, we don't want any burns or any irritations due to that. And dysreflexia, you know, unfortunately, orgasm and any sexual arousal can cause some dysreflexia. So just being mindful of that is important. And, you know, if you're participating with a partner, maybe just letting them know what to do if you do become dysreflexic, you know, if you get pretty bad dysreflexia, just so we're safe in that regard, because it can become a medical emergency if it's not treated correctly during that time. Okay. So I have another discussion for us. Let's see. Has there been any sexual devices or adaptive positions you've felt most helpful for you with sexual function? Anyone? Thoughts? Alyssa, I love you for raising your hand.
So I have found that the G-spot is key in everything, whether you have sensation or not. I just want to say that.
Okay, nice.
And also what you said about the dysreflexia. So, I mean, yeah, what I do, like, there's a point where I use my, like, the beginnings of dysreflexia, where I flip it in my head and it actually becomes stimulation. Like, as long as I don't reach the point where I'm starting to get a headache,
Yeah.
you know, or like my blood pressure is really raised, I can use it in my favor.
Mm-hmm.
And I've spoken to other people who do the same. So, you know, I don't know, that's probably dangerous a little bit, but, you know, we do what we do, right?
Yeah, I mean, you know your body best, and that's, you know, as long as you know your body and how you would feel if you were getting to that point, I think that's totally fine. I mean, if it's working in your benefit, I don't see it as a problem. But yeah, and that's the important part, is like knowing your body and knowing how you would feel and such, you know.
And I just want to add, if you're ever in a hot tub, it makes it so much easier to be on top if you're with a guy and want to be on top.
Oh,
Just,
Good advice.
you're buoyant.
yes, totally buoyant. Yes, that's
Okay.
the best way to do it.
Cool.
On top for fun.
Oh, devices too. People use Hoyer lifts. Yeah. If your partner's able-bodied and you have a Hoyer lift, get that. Don't be afraid to use the wheelchair.
Yeah. Any other input on the first one? First question?
I'll put my tilt into device at some point. I know I will.
Yeah.
Trust me, it's been a thought. It's been a thought.
Yeah.
My new chair. Let's try out my new chair.
Yes.
It elevates and tilts. So I've got all kinds
Yes,
of stuff.
definitely. Elevate and tilt.
Yes.
Yeah, those chairs got some great options.
Yeah.
in that graphic that you posted that was so nicely laid out, that last position would, I think, get everybody hurt. Just, I would probably try that one. But,
I'm gonna have to go look back and now at it.
it was,
Yeah,
I think it was
it's a memory.
the person on top was like fully upside down with like a head between the other
Oh,
person's
geez.
legs or
Oh, God. So dangerous.
Okay, any routines that you follow to assist with successful sexual participation that you feel like you want to share with the group?
Other than cathing and handling your bowel program with an adequate amount of time.
Yeah.
Now, my husband, this is really kind of TMI, but if I like pee a little bit during sex, he totally blames it on like me squirting. So
Ha!
I pass that off.
Love it.
It's like, yeah, exactly, honey.
I love that.
Oh,
That's awesome.
amazing. Okay, I have one more little piece to try to wrap it up and make things a little bit more serious. But so Natalia asked me to touch on this a little bit, and I do think this is super important. You know, there's a lot of studies that show that women with SCI and disabilities in general are less likely to get routine checkups by their gynecologists, including pap smears, mammograms. And I think it's important to note that, you know, just because you have a disability doesn't mean you're not prone to getting any sort of like cancer or anything like that. And it's still very important to go for those routine checkups and make sure everything is good there. And really that much more important because, you know, you can be more prone to like UTIs, yeast infections and things like that. So making sure everything is well, you know, down there is important. Because you may not, you know, feel some of that weird sensation that you may feel if you had a yeast infection prior or UTI, you may know it feels like there, but just being mindful of those things is important. And, you know, there are a lot of doctors out there that have wheelchair accessible options, or they may even be able to come to you too. There are options for that now. So, and I feel like COVID kind of helped with that, where like doctors are like going to people's apartments or houses and things like that. And yeah, this is my contact info. If you do have further questions that you didn't feel comfortable asking me, you know, in front of everyone, and I will send Natalia those options for dating forums and things like that. Any other like further questions, concerns?
Also, if you have information for gynecologists that make house calls that you know of,
You guys are mainly city based, so I feel
Yeah.
like I can totally find some and put together some and send them to you.
That'd be great.
Yeah.
Also, any links that you have just in general for any of the toys or lube and stuff that you talked about, if you could send them to Natalia, Natalia, do you have like a Excel resource list that you're putting together for the group or anything?
Are you offering to help me with that?
I could try. Yeah. I mean, we have one for another group that I'm in and it comes in really handy. And I think for a woman's group, I'm not great with Excel, but I'm learning.
I mean, I have a list, but it's certainly not Excel.
Oh no, if you can send me the list, I can try and make some detail out of it. I can make a pretty spreadsheet with words and not numbers. Don't give me numbers and we'll be good.
Okay, I got you. I'll send it right off to you once I get the rest from Alyssa. Yeah, got it.
So, Alyssa, I just want to, so weird saying that. I just want to add like one toy that was really beneficial to me is, and it's sort of, I kind of put it away because I now have a partner, but one that I was able to use as a quadriplegic very easily on my own was called a Flexo Pleaser, and they still have it available. It's really cheap, and it's long enough and it bends, like it's flexible. So I don't know. I mean, like, you do need to have a little bit of like, I think if you were a C4 quad, you probably couldn't use it on your own, but I think it's something that you should add, just like
Yeah.
something like that, because it really is super accessible. And it helped me a great deal when I was kind of experimenting on my journey.
Yeah, I'm gonna have to look into that.
That and
Yeah.
painter's tape.
And sorry, say that again?
Painter's tape?
Painter's tape, okay.
Yeah, well, just, like tape things to yourself without hurting your skin.
Okay.
Like I would use duct tape, but that kind of.
No, yeah, that wouldn't go well.
Oh, with the painter's tape that Alyssa and I brought up, I was at another talk on sexuality and disability. And if anybody has any painful spots that they don't want touched, a woman that I know would put tape on those parts of her body so that if her partner touched them, he would know to move his hand and not grab on or do anything in that area because it was marked off with an X.
But if it's painful, wouldn't ripping tape off of it?
No, it was just, it was like kind of like skin tape
Oh,
so that they could feel it, but it wasn't hard on their skin,
okay.
if that makes sense.
And painter's tape comes off really easy too.
Yeah.
And sticks, like sometimes the paper tape, like medical paper tape,
Uh-huh.
That'll just fall
Like-
off my skin.
yeah, it's kind of flimsy, but the painter's tape stays on and yet it doesn't like hurt your skin on the way off. As long as you're not allergic to the adhesive,
Yeah.
I found that, does anyone else have something before I continue talking? Okay, so I found that, this is random, but I found that aside from because the clitoral stimulation sometimes can be a little much for me in terms of AD or whatever, but randomly I found that when I went a little deeper, the opening to my urethra was actually really pleasurable and not overwhelming and really nice. Okay, also, for a long time, I thought that I couldn't get wet because I wasn't. And then someone came into my life and it changed. And just the first time that I ever was able to get wet, it was because this guy was tossing my salad. So it didn't even have to do with my vagina. Like the anal stimulation lubricated me and then it just became a regular thing and we were fine. Just saying, it's an option. Getting excited thinking about it, I'm sorry. Okay, I'm done. I'm done. Just say it, explore everything.
Okay, Tanya.
I'm not gonna call him. I'm not gonna call him. I'm not gonna call him. Done.
Good.
Okay, Alyssa, is there anything else?
No, that's it, guys. If you have any other questions, feel free to email me. And it was so great to meet you all. You are a great bunch.
Thank you
Thank
so much, Alyssa. This was really great.
I'm so glad you guys enjoyed it. Let me, I guess I gotta stop sharing my screen somehow. Let's see.
Oh no. Oh yeah, you can see that. Let me make sure I get this stuff off of the chat for you ladies. So I can email it, the green truck. I got the World Beauty Project and no other links, right?
Stop share.
No
There we
other,
go.
no other
The
links.
sheets that you and Tiffany were talking about, can you share that too?
What sheets? Okay, I'll put it there.
Got it?
Sports Sheets is amazing. They're a great website.
Yeah, I'll add that. I'll add that for sure.
Alrighty, guys, it was so nice to meet you. Natalia, I'll send you
Alyssa,
some of those
bye-bye.
resources, okay?
Yes,
Bye,
thank you
guys.
so much.
Thank you.
All right, ladies, it's been real.
This is fun.
Bye, everybody.
We're all good. Okay.
Bye.
Yeah,
like,
Natalia,
stay home.
Natalia, if you ever want to talk,
Me
let
too.
me know.
Okay. Okay. I will. I'm so glad
I
you
enjoy this. I enjoy this.
Good. I'm glad you
Oh.
guys were able to make it.
Oh,
Yeah,
will
I'm
we
listening.
be getting the presentation, the slideshow that she did?
Yes, I'm gonna request it and I'll get it to all of you for sure.
Question
All right,
about
thank you.
how I was working on the infographics and all that stuff. So that was basically like what I was like thinking of like working on doing. So what if
Good.
that and posted that on, I mean, what she would get all the credit. She would get like her tag on it, her name on it, everything. Like it would be hers, you know, just featured on our Instagram or whatever it is. So people can
Yeah.
actually see it. You think
Yeah.
that she would us doing that?
Yeah, I'll talk to her about it.
I think that would be great. Like
At the very least, I want to post these on YouTube and on our website. I'm gonna need help with that because I don't know how to do it, but I do want to at least do
this
that.
is my last week of school. I have my final tomorrow, and then in 2 weeks my state boards, and then I'm free to help you
Good
and do it.
luck.
Great.
Good
great,
luck.
Great. Good luck. Good luck. Good luck, Lils. You
Natalia,
got this. You got this.
Natalia,
Thank
can you post the website and the Instagram and the YouTube? Because I don't have any connections. I don't know why.
Okay. I think the website at least is on my signature, but yes, I'll add that.
Dante, do me a favor, hon.
Oh, she's talking to somebody else.
Yeah, I went 2 games.
All right.
Bye, everyone.
All right, ladies.
Bye, buddy.
Ooh,
Bye.
it's been wonderful. Thank you.
Bye, thank you.
See you all next week, hopefully. Take care. Be well. Be safe, ladies.
You
Bye.
as well.
Bye.